Our body's parathyroid glands are tiny.
I often describe them as being the size of like the tip of a pen. Other people will describe it about the size of a grain of rice, so they're very small glands.
But they play a dynamic role in our health.
The parathyroid glands produce a hormone, and this hormone regulates how our bodies hold onto calcium in our blood. When our body's levels of calcium get a little bit lower, it's a signal to our parathyroid glands that we need calcium.
And later, hear the consequences of improper parathyroid function.
I often felt like I was a 75-year-old man living in the body of a 55-year-old man, feeling absolutely miserable and couldn't imagine another 30 years of living that way.
Discover hyperparathyroidism inside this edition of CTSI Discovery Radio. Welcome to CTSI Discovery Radio. I'm your host, Brian Belmer. CTSI Discovery Radio is brought to you by the Clinical and Translational Science Institute of Southeast Wisconsin. The CTSI is a consortium of researchers, doctors, scientists, and others representing 8 institutions, including the Medical College of Wisconsin, Milwaukee School of Engineering, Marquette University, the University of Wisconsin, Milwaukee, Children's Wisconsin, Froedtert Hospital, Versity Blood Center of Wisconsin, and the Zablocki VA Medical Center. The CTSI works collaboratively across all of our member institutions. Our mission is advancing health through research and discovery. They're tiny little glands that produce an essential hormone, but when their proper function is compromised, it can have an enormous impact on our overall health. They're called parathyroid glands, and today we'll discover their form and function and learn about a specific condition linked to them. For this, we get expert insights from Dr. Tracy Wang, Professor, Department of Surgery, Division of Surgical Oncology, and Vice Chair of Strategic and Professional Development, Department of Surgery at Froedtert and the Medical College of Wisconsin. Dr. Wang first provides an overview of our parathyroid glands. Are they related to or separate from our thyroid gland?
That's a great question. It's a little bit of both. So from a function standpoint, they are completely separate from our thyroid glands. What the parathyroids do is they produce a hormone that regulates our calcium levels, but it can be confusing because they're called the parathyroid glands, and that's because of how they were found in animals in the 19th century. The thing that is related to the thyroid glands is not just that they sit around our thyroid glands, but they share a blood supply with our thyroid glands.
What's the form of our parathyroid glands? What do they look like?
They're small glands. Most people have 4 of them. I often describe them as being the size of like the tip of a pen. Other people will describe it about the size of a grain of rice, so they're very small glands.
As far as where our parathyroid glands are located,
they are located in our neck, next to our thyroid gland. We think of our thyroid as having both right and left sides. And so most people have 4 glands, 2 on the right side and 2 on the left side. And they sit in proximity to the thyroid gland, but they're not quite in the same location in everybody because of how our bodies develop.
Although we typically have 4 parathyroid glands, is it possible to have more or fewer?
Yes, but we just don't know who. Some people can have 3, some people can have what we call supernumerary or 5 glands. The problem is we don't ever know if you have more than 4 or less than 4 glands.
What's the primary function of parathyroid glands?
The parathyroid glands produce a hormone called parathyroid hormone, and this hormone regulates how our bodies hold onto calcium in our blood. When our body's levels of calcium get a little bit lower, it's a signal to our parathyroid glands that we need calcium. So the parathyroid glands will produce a little bit more hormone, and then our bodies absorb calcium from our diet, gets it from our bones, and increases our calcium levels. I often describe this as sort of like a seesaw or a nice balance, and it's constantly in flux in our bodies.
How important is healthy parathyroid function toward our overall health?
Like every everything in our bodies, it's finely tuned. So when we have a little bit too much or too little, it can have an effect on our body. Although there is always a normal range, and so not everything is going to be the exact same number if you see it on a blood test. But having too high calcium levels, which is the most common issue when we have an abnormal parathyroid gland, having these too high calcium levels can have effects on our bodies and can have effect on our overall health.
Next, Dr. Wang shares expert insights on one specific condition of the parathyroid gland, known as
hyperparathyroidism. There's a few different forms of it, but primary hyperparathyroidism is when our parathyroid glands are not functioning properly and are overproducing parathyroid hormone, which causes our levels of calcium in our blood to be too high.
There's also
secondary hyperparathyroidism. There's a couple of different causes for it. It can be because our bodies are too low on certain forms of vitamin D, then causes our bodies to produce too much parathyroid hormone. Most commonly, we see secondary hyperparathyroidism in patients who have chronic renal disease or end-stage renal disease because of how the kidneys are functioning and metabolizing calcium and phosphorus. It triggers the parathyroid glands to produce too much parathyroid hormone.
secondary hyperparathyroidism is also different from primary
in that our calcium levels don't get high in that instance because it's compensating for the renal disease.
And then there's tertiary hyperparathyroidism, which Dr. Wang tells us
is complicated. There's a couple different forms of tertiary, but really it exists in patients who had secondary hyperparathyroidism and then had a renal transplant, and sort of the parathyroid glands kick in and you end up seeing high calcium levels because the parathyroid glands are still overfunctioning, but it's often seen in patients who've had renal transplants after secondary hyperparathyroidism.
While any of the three varieties can be concerning,
they all have different consequences, and because secondary hyperparathyroidism and often tertiary is most often seen in patients with renal disease, it's a little bit of a different patient population, so the potential effects of parathyroid disease might be a little bit different for those patients because of the consequences to their kidneys, or if they have a transplant to their graft kidney. It's a little bit different than in primary hyperparathyroidism, where we're more worried about the long-term effects of having too much calcium in your body.
Looking specifically at primary hyperparathyroidism, what kind of complications can it cause for a patient?
When you have too much PTH, parathyroid hormone, it causes your body to hold on to calcium, and so it causes your blood levels of calcium to be too high.
It's this combination of inappropriately high levels of calcium and PTH hormone that can have long-term consequences.
Because it stimulates your bones to release calcium, which can lead to changes in your bone mineral density. It can cause your kidneys to need to filter a lot more calcium running through your blood, which we think can have effects on your kidney health and potentially be a risk factor for developing kidney stones. So these are some of the potential complications in patients who have too much parathyroid hormone.
How concerning are the potential consequences of primary hyperparathyroidism?
There are some really good studies that show some of these consequences of hyperparathyroidism don't happen for many, many years, but it's very hard to predict the effect of this disease on any one person. We know that it can cause all of these things, and so for any given person, how the disease presents and how consequences for each patient can be a little bit different. We do know that it generally is something that happens over time, so it's not something that happens necessarily immediately.
What about symptoms? Dr. Wang says some traditional symptoms include
kidney stones. Patients who have effects on their bone health and have bone mineral density changes can sometimes break something just because their bones are weaker from having the hyperparathyroidism. Some patients may also have heartburn, esophageal reflux disease, and or develop peptic ulcer disease. But these were a lot of the symptoms we used to see when it was diagnosed at a lot later stage of disease.
However, today, there are many less specific symptoms that can be associated with primary hyperparathyroidism.
Some patients can experience low energy levels and fatigue, muscle weakness, difficulty in memory and concentration. A lot of patients tell me they feel like their brain is kind of foggy. We know that it can have effects on sleep habits or having bone pain and weakness. So there's a wide variety of symptoms that patients can experience.
You're probably wondering, I was, what causes primary hyperparathyroidism? Is this an inherited disease?
Most forms of primary hyperparathyroidism are sporadic, so we don't necessarily know why people get it. There is a subset of patients for whom primary hyperparathyroidism can be due to a mutation and be inherited. We do consider a genetic component in anyone who has relatives who have had primary hyperparathyroidism, or if patients have primary hyperparathyroidism at a relatively young age. We will recommend genetic testing to make sure that they don't have an inherited form of this disease.
How is primary hyperparathyroidism typically diagnosed?
Most commonly, people get blood work and they find out that your calcium level is a little bit high. And this usually then prompts an additional evaluation. So we would commonly get calcium levels. We would get a parathyroid hormone level, of course, look at your renal function, look at your vitamin D levels. And looking at the group of labs together can sometimes help us diagnose primary hyperparathyroidism. But the most common thing in the diagnosis is high calcium levels and parathyroid hormone levels that are inappropriately high.
How many people in the U.S. are diagnosed with hyperparathyroidism?
We think there's about 100,000 new cases diagnosed each year in the United States. That's between 1 and 3 per 1,000 people. We also know that primary hyperparathyroidism is underdiagnosed in the United States. So there have been some really good studies looking at large groups of patients where patients with high calcium levels have never been evaluated. So we do think that that is an underestimate of who has primary hyperparathyroidism.
Is it considered a common or a rare disease?
Overall, it's probably still relatively rare. It is the most common reason for patients to have high calcium levels, but it's still a relatively infrequent diagnosis, although people are becoming more aware of it, and I think that's helping diagnose patients at an earlier stage.
Who does it most often impact? Are there particularly susceptible populations?
We typically see it in patients who are a little bit older, not young children or young adults. We often see it more commonly in women than men. Otherwise, we see it across all ages and both genders.
Next, Dr. Wang shares how it's treated.
There's currently no medication that is FDA approved to treat primary hyperparathyroidism. If patients have this, really the only curative option is taking out the gland or glands that are abnormal. But there's no medication that's routinely treated for primary hyperparathyroidism.
With surgery being the only viable option, she assures us
parathyroid glands can be safely removed. You can actually remove more than one parathyroid gland. You actually only need a little bit of one to have normal function. And in fact, 25 to 30% of patients who have primary hyperparathyroidism have more than one gland be abnormal and need to be removed at the time of surgery.
When is surgery recommended?
We generally recommend surgery in people who have developed kidney stones, have broken bones, maybe have bad reflux or peptic ulcer disease. We also recommend surgery based on some of their labs. So if your calcium level is above a certain threshold, patients who are younger, so there's a rough guideline of age 50, we recommend surgery.
Surgery might also be recommended for
patients who have osteoporosis, because we know that this can have ongoing effects on kidneys and your bones. We also recommend surgery in patients when their urine calcium level is above a certain threshold, because we think that that can be a risk factor for developing kidney stones. So that's another indication for surgery.
Is hyperparathyroidism preventable?
Nope.
Dang.
No, there's nothing environmental or anything like that that causes hyperparathyroidism to develop. There's nothing that can be modified from a lifestyle standpoint that can do anything.
Fortunately, Dr. Wang says,
there's a lot of research being done on the consequences of hyperparathyroidism and seeing how surgery benefits patients, both with respect to the symptoms and those nonspecific symptoms. There's been a fair number of research on patient quality of life after surgery.
Research making discoveries that positively impact patients.
We did a study here that looked at patients' sleep habits and quality of sleep after surgery, and we were able to show that about 30 to 40% of our patients after surgery, within about a month of surgery, would tell us that they feel better, whether it's improvement in their sleep, improvement in their energy, improvement in sort of their body aches and pains. They notice significant improvement. And so that's been really, really helpful for us to counsel patients on what they can potentially expect after surgery.
Can someone have a normal life expectancy and a good quality of life living with hyperparathyroidism?
Hyperparathyroidism is not always, but almost always, a benign condition in that it's not a cancer. So it really should not affect life expectancy in that way. If they are someone who develops some of the more significant complications from this, that might affect quality of life, but not life expectancy. But that's a hard question to answer because I think how people are affected by the disease can be so variable and very individual for each patient.
And as individual patients, she encourages us to be vigilant and advocate for ourselves.
If you notice on your lab work that your calcium levels have been a little bit on the high side or above normal, ask your doctor about it. You might not yet know you have hyperparathyroidism, and it's important to have that investigated. If you are diagnosed with it, you can have the information you need to decide if surgery is the right thing for you. And if you do have it, surgery is very safe, and patients really do have benefits in the long term to their overall health after surgery.
If you want to learn more,
there's always our MCW and Freighter internet pages that have information on our programs and about the disease, and so certainly there's a lot of resources that can be found on the internet.
Because after all, with this or any disease, knowledge is power.
Inform yourself, talk to your doctors about hyperparathyroidism so that you are well informed about the options that you have.
What's it like living with primary hyperparathyroidism? What about having parathyroid gland surgery to treat it? We're about to discover one man's experience. Let's meet him now.
My name's Monty. I'm from Oconomowoc, Wisconsin. I'm 55 years old, retired, married to my beautiful wife, Chris. We have 2 wonderful grown adult children.
And living a pretty active life.
I enjoy traveling, been to 7 continents now, and I oddly like researching things, whether it's travel-related things or medical disease or family genealogy. I spend a lot of time with passion researching various topics.
All adding up to a life he genuinely enjoys living.
I would say I'm very fulfilled. I feel very fortunate to be alive with great family and friends. I live a pretty good life, I'd have to say. I was able to retire early, so that's been a great thing.
Still, it hasn't been without health challenges, both in childhood.
As a child, I ran into a lot of broken bones, broke both my arms, I had a fracture in my right lower leg.
As well as in adulthood.
In my 40s or so, I started to develop kidney stones, passed around 7 or so of those naturally, and I had 4 separate surgical procedures to remove kidney stones. I had a bone scan done that determined that I have osteopenia, which is a precursor to osteoporosis. I have also suffered from laryngeal esophageal reflux. It's a hard-to-treat reflux that doesn't come with the traditional burning from acid reflux.
But wait, there's more.
Ended up having a lot of constipation and bloating later in life that eventually turned into gastric paresis, which is a pretty serious stoppage of peristalsis action in your intestines that keeps things moving. I ended up having heart palpitations, atrial fibrillation, which is the worst flavor of the heart palpitations.
Then, about 6 years ago, Monty developed symptoms leading him to believe something else was compromising his health.
I was having difficulty explaining to my primary care physician different pains that I was having in my abdomen area. I ended up getting an abdominal CAT scan done, and in the process of that, I had my PTH tested.
That parathyroid hormone, or PTH test, set Monty on a 6-year health challenge odyssey, during which
I often felt like I was a 75-year-old man living in the body of a 55-year-old man. Blood pressure became very difficult to control. I ended up adding about 4 different blood pressure medicines, heart palpitations, sleep apnea.
And as if these newly experienced symptoms weren't concerning enough,
there was a point where I started to trip on the carpet, and it was really weird. I'd just be walking along, and all of a sudden I'd start to trip. Found out later that I had small lacunar strokes that occurred, had an incidence of vertigo that occurred at work, so I was sent to the ER for a full stroke workup. Found out I had these small lacunar strokes, a small brain aneurysm, and a hole in my heart.
Monty was in rough shape. After learning that he had elevated parathyroid hormone levels,
I ended up going to a nephrologist and found out that I had elevated calcium levels in my urine. Went on to see an endocrinologist. Went through 3 different endocrinologists with different levels of expertise.
Signs pointed to some form of hyperparathyroidism. But when Monty was referred to a parathyroid surgeon,
the surgeon didn't think the way my numbers turned out was enough to validate having a parathyroidectomy done at that time, so I was denied surgery.
Understandably, Monty sought a second opinion.
So I did that with a high-volume surgery center down in Florida, and they also agreed my numbers didn't quite add up, so they also denied surgery.
Meanwhile, his debilitating symptoms persisted for nearly 6 years.
Eventually, I got to a point in my life I was feeling absolutely miserable and couldn't imagine another 30 years of life living that way.
So, desperate times called for desperate measures.
I myself decided then to retire. Thankfully, I was in a position I was able to do that. I went up to the Mayo Clinic to get a full workup to find out what might be wrong with me. Saw all kinds of different doctors up there, had many different tests.
And eventually, finally, resulting in a diagnosis.
I'm diagnosed with what's called normal calcemic hyperparathyroidism. It's when your calcium is not elevated, but your parathyroid hormone was not recognized as a type of hyperparathyroidism until around 2008, and it's still not very well understood by the medical community.
Fortunately, while his specific type of hyperparathyroidism isn't too well understood in general,
at Mayo they tend to understand it pretty well. I was told about 1/3 of the surgeries that they do for parathyroidectomies are actually done in normal calcemic individuals, where many surgery centers won't even entertain that idea.
Now with a diagnosis, what was Monty told about his treatment and his prognosis?
Well, because I have this kind of rarish calcemic hyperparathyroidism, I wasn't offered any guarantees in terms of it's going to help my symptoms. A lot of people do experience improvements in symptoms, and some people don't. So I was warned and cautioned that that could be a thing if I were to pursue surgery. They offered surgery, but would not directly sort of recommend surgery.
Once informed about his prognosis and the possibility of surgery, what were his immediate concerns?
I guess my biggest worry about having surgery is really the worst case scenario where too much parathyroid tissue can be taken out and you end up with not enough PTH production, and that will normally result in hypocalcemia or not enough calcium in your blood, which becomes very tricky to manage.
But in weighing the risks versus the benefits of having surgery,
it was clear for me that the benefits outweighed the risks. The surgery itself is successful somewhere around 97% of the time or more, so that's a pretty good rate of risk return.
And so, Monty had surgery.
They performed a parathyroidectomy. There's two different that are often done. A targeted parathyroidectomy, or what's called a bilateral neck exploration. And one often evolves into the other. So once they localize an overgrown gland, they'll target that gland first, and they'll check and see if your PTH has come down to an adequate level. If it has, they know they got the targeted gland and they stop the surgery.
However, in Monty's case,
my PTH didn't come down enough, so they had to extend the surgery or evolve it into this bilateral neck exploration where they look on both sides and they remove 2 other parathyroid glands. Most people have 4 parathyroid glands. I'm left with 1 parathyroid gland. I'm told is enough to give me normal PTH production with it.
Today, a couple of months post-surgery, how's he feeling now?
I had the surgery done and it was like night and day, the best thing that ever happened. I felt at least a decade younger almost immediately after surgery. Prior to surgery, I had difficulty walking down stairs. I used to have pain every time I would get up out of a chair or get out of a car seat. All of that is gone now. I don't have that anymore.
There were other immediate benefits from having the surgery.
The most obvious thing to me immediately after surgery was my ability to sleep through the night. Prior to that, I simply could not sleep through the night. I had tremendous pain that I would wake up with. Immediately after surgery, that pain was gone and I was able to sleep.
This tracks with what Dr. Wang told us about sleep after parathyroidectomy surgery.
We did a study here that looked at patients' sleep habits and quality of sleep after surgery, and we were able to show that about 30 to 40% of our patients after surgery would tell us that they feel better.
What about negative side effects from the surgery? Were there any?
Right right after surgery. I had something called transient thyroiditis. It's basically from the manipulation of the thyroid gland, where they try to find your parathyroid glands, and the thyroid can get a little angry. It produces excessive thyroid hormone even though the body isn't asking for it. So that landed me in the ER.
Knowing what he knows and feeling how he feels now, how concerned is Monty about hyperparathyroidism going forward?
Now that I've had parathyroidectomy, I am expecting to be fully cured. Many of my symptoms are gone. I'm hoping for some continued improvement. I would say that my diagnosis is no longer greatly concerning to me. So it gives me a very, very good outlook for what my future should be like for this disease.
But despite his confidence, there's still one lingering concern.
The possibility of recurrence. I worry about the one gland that I have left getting overgrown again and bringing back symptoms.
The good news is Monty has found a community of people just like him, providing resources and support.
I had been participating in a Facebook group called the Hyperparathyroidism Support and Information Group, the world's largest parathyroid support group on Facebook. It's got over 17,000 members. I got involved with it just before my surgery to kind of find out what other people were experiencing.
This global online community has helped him in many ways.
It's definitely helped with the acceptance, and gosh, I sure wish I would have found the group 6 years prior. I would have learned how difficult it can be to get diagnosed sometimes, and how much self-advocacy that we have to do as patients to push through the system, get a proper diagnosis, and get the only treatment proven to be effective and be a cure, which is surgery.
And it's empowered Monty to help others.
After being involved with it for about 2 months, because of all the research I had done, I built up a wealth of information. The founder of the group asked me to be one of the moderators, so I become very, very involved with that group. We get about 200 new members every month, and we do our best to help them through their own journeys with hyperparathyroidism.
One thing he's not participated in yet, but is open to, is clinical research focused on the disease.
I would absolutely be involved in any sort of clinical research if it were to happen. It's a disease that not enough research is being done to fully understand all the different variants of it. It's tremendously underdiagnosed. Often we're way far down into the depths of the disease by the time that the first test is done that could ever diagnose it.
In the meantime, for anyone wanting more information or support,
join the Hyperparathyroidism and Support and Information Group on Facebook. There's an absolute wealth of information. No matter how obscure your situation is, I guarantee you one of our 17,000 members has been in something similar. Anything that's ever been seen in the medical community somewhere pretty much exists in this group, with firsthand accounts of people that you can talk to and understand how your condition could be treated.
Monty says, although hyperparathyroidism negatively impacted his life for quite a while,
I felt incredibly unhealthy, and it was depressing at times. I got to a point where I wasn't picturing it was going to be a very long life. I honestly didn't know how I was going to live another 20 years.
Thanks to successful surgery and support from his family, friends, and online community.
The big difference now is I have a lot of hope for the future. I have a very renewed interest in living, and I'm looking forward to the next 30 years.
Very inspiring. But now we're all out of time for this edition of CTSI Discovery Radio. As always, thanks to each of our guests for appearing on today's show, Dr. Tracy Wang, and special thanks to Monty. I hope you've discovered something by listening to today's show, and I'm doubly hopeful you'll join us again next time. CTSI Discovery Radio airs the third Friday of every month. Make an appointment on your calendar and join us for each episode. On behalf of the Clinical and Translational Science Institute of Southeast Wisconsin and all of our affiliate partners and members, I'm Brian Belmer, wishing you happier, healthier days ahead. For more information about research or to listen to the podcast of this or any of our shows on demand, please visit our website, at ctsi.mcw.edu. CTSI Discovery Radio is written, produced, and hosted by Brian Belmer in collaboration with WMSE Radio. The CTSI and this program are under the direction of Dr. Reza Shakir.